Neurological diseases and conditions. Treatment, if it's from a toxic substance exposure, then it would be to eliminate those, correct any nutritional deficiency that may be involved, um, control the disease process that may be producing it, avoid alcohol, um, give anticonvulsants and tricyclic antidepressants as medications may be used in physical therapy. Trigeminal neuralgia, or sometimes called tic douloureux, um, painful area of the fifth cranial nerve or the trigeminal nerve as the cause. They'll have pain sometimes with that. Um, so when the ophthalmic branch is affected, pain is with the eye or the forehead. If it's the maxillary branch, it'll be nose, upper lip, and cheek. And if it's a mandibular, it's going to be the lower lip or the tongue or the cheek close to the ear. So which which location makes a difference in what's felt. Cause is not really known. Um, eh, we see it sometimes as a part of any kind of nerve root or tumor vascular lesion effect. Um, Analgesics for pain, medications for anticonvulsants for some of the other symptoms, and muscle relaxants may be some of the medications that are used. Bell palsy or Bell's palsy is a disorder of the facial nerve, and in this case, it's the seventh cranial nerve. It causes weakness and paralysis of the facial muscles on one side, um, and it, of course, being one side, you evaluate them first for a CVA or a stroke, just to be sure. Um, the symptoms basically cause compression of the nerves in the bony canal and causes the symptoms the patient will have. So they'll kind of feel a drawing behind the ear. They'll have inability to close one eye and the drooping of the mouth and drooping and saliva leakage and so forth. So it look like their one side of their face is kind of fallen. Um, they won't be able to smile. Um, Grimace, make a face. Um, their taste perception may be decreased. Um, Not sure what causes it. Is usually self-limiting. It goes away in a few days to a week or two, typically, and usually don't recur. Early treatment is important. Um, Recovery is usually just it comes almost as quickly as it goes, almost as quickly as it comes, especially in those that are younger. Treatment, warm, gentle, moist heat massage, facial exercises to help keep the muscle tone. Be given prednisone to decrease the swelling in the facial nerve. Something for pain, analgesics. May give them artificial tears and an eye patch because the other thing is they won't be able to close that eye fully. So risk of injury to the eye is always a concern. And then electrotherapy to stimulate the nerves and prevent atrophy of the muscles. In comparing Bell's palsy to trigeminal neuralgia, in Bell's palsy, they'll have a sudden paralysis, they'll have motor function impairment, the inability to move certain parts, and then the prognosis in early treatment is good. In trigeminal, they'll have extreme pain, no motor function involved, and the prognosis varies with it. Meningitis is an inflammation of the meninges of the covering the brain and the spinal cord. Um, Symptoms are vomiting, headache, increased intensity with movement and shaking of the head. Um, they refer to it as nuchal rigidity. So that stiffness of the neck is a key point in this. Um, Diagnostically, they'll do a lumbar puncture looking for the presence of white cells, protein, and glucose. Um, Deep tendon reflexes increase. Patient is irritable. They have photophobia or difficulty with lights, and they're hypersensitive. It can be either bacterial or viral. So the first decision making probably is going to be determining which type it is. Treatment is aggressive antibiotic therapy, anticonvulsive drugs, glucocorticoids, aspirin, acetaminophen for headache, and having them in a dark, quiet space. Unknown those with a known cause may be given prophylactic antibiotics, so treating it for bacterial in that case. Encephalitis may come on slowly or as a sudden onset. It's an inflammation of the brain. They will typically report a stiffness in the neck and the back, and muscle weakness, headache, fever, um, and it's just the signs and symptoms. A lot of times will bring them in to be seen. Um, the stiffness in the neck and the back is a key thing to look for. It's caused by viruses or toxins, and from chickenpox, measles, and mumps. Most cases are the result of a bite from an infected mosquito. Treatment for encephalitis is antivirals um, against herpes simplex encephalitis version. Prognosis is unpredictable, depends on the type of infection and how well it responds to treatment. Um, and reducing the mosquito population is one of the things that are beneficial in prevention. They may give them mild analgesics for pain, give them anticonvulsants and antibiotics. Then they'll stress, of course, using mosquito repellents when they're outside.